This community is growing. It is growing by leaps and bounds, probably faster than most communities across the country. It's so important that we grow with it.
When we first opened, we had a helicopter pad and we had a transport team, and their sole purpose was to bring the sick patients from Plano back to Dallas. Now we've morphed into a large pediatric hospital where those same ambulances and helicopters are actually bringing the patients to stay at Plano. The option to have the space here has been really due to the foresight that the leadership team had at Children's at the time to have purchased the amount of land that we did. The fact that this is a really full-service pediatric hospital that's not in an urban setting, which is really somewhat unique when you talk about children's hospitals.
To have 180 acres that the hospital is situated on, and to be able to have the nature and kind of a healing environment wrapped around the hospital just provides that extra respite for not only our patients, but their families when they're here on campus.
The tower itself is cutting edge and the newest technology that's available to us today. But the building doesn't do anything without the people who make it happen.
We're family. We're not just a group of team members. Being able to extend that family and to grow that family along with growing our physical footprint here is what we're most excited about.
I think it's an amazing time in science because we are able to be a leader and breeding those new technologies that potentially cure these diseases. Seeing these kids, it changes their entire life.
I really want to make sure we thank all the teams that have made it possible. It's leadership across the organization, it's employees across the organization, it's our patients and families. It comes in the way of donors who have said, you know what, this is important. I want to be able to be a part of it, and they have supported us as well. We're just really fortunate to be able to be in this position and looking forward to being able to drive forward the growth that this community deserves.
Children's Health and UT Southwestern have collaborated over the last 4 years with the goal being it's one program, 2 campuses. For every family, they want the best care possible.
I'm Kimberly, this is Dylan. One day, Dylan became very jaundiced and we went to Children's in Dallas. After a lot of testing, the liver seemed to resolve, but it evolved into aplastic anemia, and that was how we began seeing Dr. Dickerson.
Dylan and I met when Dylan was admitted to our liver service in Dallas. Initially, that was care that could only be provided in Dallas.
When you have to make the drive down to Dallas, there's a lot of anticipation, especially because he knows there's going to be IVs and needle pokes, and now it's such a quick trip.
Dylan was coming to clinic at least once, if not twice a week. It was much easier for mom and dad and Dylan to come to clinic right here in their backyard. With the expansion and including the new tower, we hope to be able to provide care to any type of patient with a blood disorder.
The nice thing about the new tower, there is a new clinic going in for the hematology oncology program. We've brought more physicians specializing in the different areas of hematology and oncology. Clinical research and even lab research are really important. We have been able to build our clinical trials program and expand it into the Plano campus. Our goal is to cure all diseases.
He is now off of all medication and treatments. We're grateful to all of Children's Health. We have a healthy child now.
When we began this process in 2005, we were seeking to raise $15 million from the community to help us bring this about. At the time, that was the largest philanthropic campaign ever undertaken in Collin County. We have made our aspiration of a 72-bed hospital and outpatient services, followed by the Andrews Institute and other investment, a reality across the years. And now, as we have endeavored to create an incremental 140 beds on this campus, the community has supported us yet again, which as a not-for-profit organization enables us to reinvest in the community and the kids and families of this community, offering health care closer to home.